reflux is referred to the gastroesophageal reflux, meaning contents from the stomach coming up through the esophagus and sometimes even all the way up out of mouth, and sometimes that may be reflected as spit up or gagging or things like that in babies. That's actually considered a normal finding in newborns and most young infants. It's just because of the floppiness of the muscle that separates the stomach from the esophagus, and so a lot of babies, due to gravity, if you lay them back or if you're moving them around a lot after feeding, some of those contents will come back up and baby may cough, may make like a strange face, or may actually spit up. Those are, again, normal findings and not typically concerning unless causes significant issues. Typically things that we look for to talk about maybe some complicated or gastroesophageal reflux disease is a baby cannot gain weight because they're vomiting too much, or when contents from the stomach come back up together with acid, and that causes lots of pain. So baby's super fussy, arching their back, not acting normal because of the pain, and occasionally even refusing to eat. So all of those things that may affect the weight gain or how much a baby thrives, those are things that are usually concerning. But just the fact that baby has a little bit of reflux or a little bit of spitting up is typically just a normal finding, and most babies will outgrow that. Address it with your primary care provider and first establish the diagnosis, is it real reflux or not. And then the second thing is for what we call uncomplicated reflux, or a reflux that doesn't need medication or doesn't need any other measures. It's just mostly trying to do things to avoid the gravity from causing those stomach contents from coming back up. So some of those things would be burping baby frequently, avoiding to overfeed. So sometimes, especially bottle-fed babies, we can be giving too much of a volume, so distending the tummy too fast, too quickly may cause more likelihood to babies to spit up. And then other things like that would be keeping baby upright after the feeding, so waiting about 20-30 minutes, keeping baby in the upright position rather than laying them back down right away, because that is more likely for the reflux to occur. And then if you feel like your baby's in a lot of pain, or if you feel like baby may not be keeping enough stuff down, that maybe they're not getting enough calories to thrive, always doing a weight check, and again touching base with your doctor will be important.